Welcome to the Medicare 101 presentation brought to you by the Medicare Medicaid Assistance Program, often referred to as Mapp. Today, we're going to learn about what Mapp can provide to you as a service, as well as all of the Medicare basics that you need to know. Mapp is comprised of counselors that are certified and have been trained in healthcare benefit counseling. This includes Medicare, Medicaid, and other insurance products. Mapp counselors are not connected with any insurance company and they are not licensed to sell insurance. In many states, Mapp is referred to as the SHIP program, which is the State Health Insurance Program. A Mapp counselor can help understand new healthcare options, understand Medicare and Medicaid, compare or enroll in Medicare prescription drug coverage, review Medicare supplemental insurance needs, understand Medicare health plans, apply for Medicaid or a Medicare savings program, and identify and report Medicare and Medicaid fraud and scams. Medicare is health insurance for three groups of people. Those three groups are people 65 and older, people under 65 with certain disabilities, or people of any age with end-stage renal disease. It is administered through the Centers for Medicare and Medicaid Services, and the enrollment takes place through either the Social Security Administration or the Railroad Retirement Board for railroad retirees. For those already receiving Social Security benefits, for example, getting an early retirement, those individuals will automatically be enrolled in Medicare Part A and Part B without any additional application. They will receive an initial enrollment period package, which includes their Medicare ID card and other information. This package will arrive to them about 3 months before they turn 65, or 3 months before their 25th month of disability if they are receiving disability benefits. If someone is not getting Social Security or Railroad Retirement Board benefits, for instance, maybe they're still working, they will need to sign up for Part A even if they're eligible to get it premium free. They should contact Social Security 3 months before they turn 65. If they work for the railroad, contact the Railroad Retirement Board to sign up. While Medicare is administered through the Centers for Medicare and Medicaid Services, the Social Security Administration is responsible for enrolling most people in Medicare. The Railroad Retirement Board is responsible for enrolling railroad retirees in Medicare. You don't have to be retired to enroll in Medicare benefits. The retirement age has actually increased to 67 years of age for persons born in 1960 or later, but you can still receive full Medicare benefits at the age of 65. Signing up for Medicare should take place during your initial enrollment period. The initial enrollment period lasts 7 months. It begins 3 months before you turn 65, includes the month that you turn 65, and ends 3 months after you turn 65. The earlier you enroll, the earlier you have access to your Medicare benefits. There are other times that you may wish to enroll in Medicare, but if you delay and you don't have a good reason for it, you may end up paying a penalty. The original Medicare card is red, white, and blue, and it's used when a beneficiary gets health care. The Medicare card shows the Medicare coverage, Part A for hospital coverage, and or Part B for medical coverage, along with the date that the coverage starts. If you choose another Medicare health plan, such as a Medicare Advantage plan, your plan may give you a card to use when you get healthcare services and supplies. You should contact Social Security or the Railroad Retirement Board if you receive railroad retirement benefits if any information on your original Medicare card is incorrect. If you do not want to enroll in Medicare Part B, follow the directions on the back of the card and return it. We will talk more about why you might want to delay your enrollment into Part B later in the presentation. Medicare has 4 parts. Part A is the hospital insurance. Part B is medical insurance. Part C is a Medicare Advantage plan. And Part D is Medicare prescription drug coverage. When you first enroll in Medicare, and during certain times of the year, you can choose how to get your Medicare coverage. There are two main ways to get Medicare coverage. First is through Original Medicare. Original Medicare includes Medicare Part A, hospital insurance, and Part B, medical insurance. You may wish to enroll in a Medicare Part D drug coverage plan. To help pay for your out-of-pocket costs in Original Medicare, like the 20% coinsurance, you can also shop for and buy supplemental coverage or a Medicare Medigap plan, all of which can be used at your doctor or hospital that takes Medicare anywhere in the U.S. Medicare Advantage is your second option to get Medicare. This is often referred to as Medicare Part C. Medicare Advantage is an all-in-one alternative to Original Medicare. These are bundled plans which include Medicare Part A, Medicare Part B, and usually Medicare Part D coverage. Plans may have lower out-of-pocket costs than Original Medicare, and in many cases, you'll need to use doctors who are in the plan's network. And some plans may even offer extra benefits that Original Medicare doesn't cover, like vision, hearing, dental, and more. Within Original Medicare is Part A and Part B. Medicare Part A is hospital insurance that helps to pay for medically necessary services received at the hospital under inpatient care, skilled nursing facility care, home health care, hospice care, and more. Medicare Part B covers a number of medically necessary services and supplies within the doctor's office, outpatient medical and surgical facilities, home health care services, durable medical equipment, and preventative services like exams, lab tests, screenings, and shots to help prevent, find, or manage a medical problem. This chart shows some of the various costs for hospitalization, which falls under Medicare Part A for 2021. Typically, Medicare Part A is a $0 premium for most people. However, if you have less than 39 working credits, and it's between 30 to 39 working credits, there is a premium of $259. If you've worked less than 30 working credits, the premium for Medicare Part A is $471. This chart shows the general costs for Medicare Part B in 2021. The Medicare Part B premium is $148.50 per month. There's also an annual deductible for Medicare Part B that is $203 in 2021. If a beneficiary is also eligible for Medicaid or extra help, which we will discuss later, these charges can be reduced. All beneficiaries that are new to Medicare get what is called a Welcome to Medicare visit with their doctor. It's a great way to get up to date on important screenings and shots and to review your medical history. The Welcome to Medicare visit is only offered within the first 12 months of getting Medicare Part B. During the visit, there may be an exam with the doctor, and they will review the following: medical and social history, height, weight, body mass index, blood pressure, and a simple vision test, potential risk factors for depression, the review of functional ability and level of safety, which means an assessment of hearing impairment, the ability to successfully perform activities of daily living, fall risk, and home safety. Individuals will get advice to help them prevent disease, improve health, and stay well. They should also get a brief written plan, like a checklist, letting them know if any additional screenings or preventative services are needed. At this visit, the doctor may also refer for additional Medicare covered screenings if the referral is a result of the initial Welcome to Medicare visit. There's no cost if the doctor accepts Medicare assignment. It's a great benefit that people can take advantage of. Medicare also covers a yearly wellness visit. After you've had Medicare Part B for longer than 12 months, you can get an annual wellness visit to develop or update a preventative plan just for you. Medicare covers one annual wellness visit every 12 months. During this visit, your doctor will record your blood pressure, height, and weight measurements, review your potential risk factors for depression, review your functional ability and level of safety, which means an assessment of the following: hearing impairment, ability to successfully perform activities of daily living, fall risk, and home safety. They may also give advice to help prevent disease, improve your health, and stay well. You'll get a brief written plan, like a checklist, letting you know which screenings and other preventative services you need over the next 5 to 10 years. You don't need to get the Welcome to Medicare visit before getting an annual wellness visit. However, if you did choose to take the Welcome to Medicare visit, you'll have to wait 12 months before you can get your first annual wellness visit. You'll pay nothing for this exam if the doctor accepts Medicare assignment. In addition to the Welcome to Medicare visit and yearly Medicare visits, Medicare covers a number of other preventative and wellness services. This slide details just a few of the wellness and preventative services covered by Medicare. Many other services are covered, such as bone mass measurement, glaucoma tests, diabetes self-management training, and obesity screening and counseling. This is a list of the Medicare recommended vaccines for adults. It is recommended that you should get the flu shot every fall before flu spreads into your community. Although getting vaccinated later can be beneficial to your health and reduce the risk of flu-related complications. There's also the new shingles vaccine, Shingrix. It is more effective than the one-dose series of Zostafix, and the CDC recommends that you receive the two-dose series of Shingrix even if you've had or received the Zostavax before. Be sure to check with your insurance if Shingrix will be covered if you've already received Zostavax. This is a great resource that includes all the information we discussed on the previous slide, but this you can take home with you. It's developed by the Lake Superior Quality Improvement Network and can be viewed and printed online. Medigap, often referred to as Medicare supplemental insurance policies, are private health insurance policies that cover only the policyholder. They are sold by private insurance companies to supplement the original Medicare or help pay for the gaps in original Medicare coverage, like deductibles, coinsurance, and copayments. They pay for Medicare-covered services provided by any doctor, hospital, or provider that accepts Medicare. Medigap may cover certain things that Medicare doesn't, depending on the Medigap plan. They must follow federal and state laws that protect people with Medicare. All of the Medigap plans listed on this chart cover the basic benefits. The basic benefits include the Medicare Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used up, the Medicare Part B coinsurance or copayment, the first 3 pints of blood if needed for a transfusion, and the Part A hospice care coinsurance or copayment. Each Medigap plan covers different additional benefits. Plans C and F are no longer available to be sold after 2021 to beneficiaries that are new to Medicare on or after January 1st of 2020. While they do cover Part B excess charges, the price of these policies is likely to increase as the risk pool decreases. While technically Part D is optional, in most cases there are penalties to not getting into a Medicare Part D plan. Part D is the most complicated part of enrolling in Medicare. It involves researching plans, comparing prices, and more. MAP counselors are trained to assist beneficiaries and take the stress out of enrolling. People with limited income and resources may be able to get extra help to help pay for their Medicare drug plan. There are different rules for how they choose a plan. Medicare Part D is available for all people with Medicare. You can have just Part A, just have Part B, or have both Medicare Parts A and B. You must live in your plan's service area. You cannot live outside of the US. You cannot be incarcerated. And you must enroll in the plan, in most cases by completing an application. Again, MAP counselors can help with this. Some people with limited income and resources are automatically enrolled into Medicare Part D plans. Medicare Part D is Medicare's prescription drug coverage. The coverage is provided through Medicare prescription drug plans or Medicare Advantage plans. Part D plans must cover a range of drugs in each category. You can join a Medicare prescription drug plan when you first become eligible for Medicare. An example, your initial enrollment period. That initial enrollment period begins 3 months before you turn 65, the month you turn 65, and ends 3 months after you turn 65. After you enroll in a Medicare prescription drug plan, you must remain with that plan for the rest of the calendar year. You can also enroll in a Medicare Part D plan during the annual coordinated election period, also known as Medicare Open Enrollment. That takes place October 15th through December 7th each year. Any changes that you make during open enrollment period yields the coverage to start January 1st the following year. There are also times when you can disenroll or get a special enrollment period to enroll in a Medicare Part D plan. Some of those special enrollment periods may include having the Extra Help program, an involuntary loss of credible coverage, a move outside of the plan service area, and more. Medicare Advantage is also called Part C. They are health plan options approved by Medicare, run by private insurance companies, and they are generally either an HMO or a PPO. Medicare pays amounts for each member's care. The Advantage plans are another way to get your Medicare coverage. If you join, you may have to use their network doctors or hospitals. Medicare Advantage plans are health plan options that are approved by Medicare, that are offered by private insurance companies, and they sign a contract with Medicare. They are part of the Medicare program, and Medicare pays a set amount of money to these private health plans for their members' health care. In a Medicare Advantage plan, you may have to use doctors and hospitals that belong to the plan or are considered in-network. You still have Medicare rights and protections. You still get all of your regular Medicare approved and covered Part A and B services. You may get additional benefits offered through the plan, including Medicare prescription drug coverage. Other extra benefits can include coverage for vision, hearing, or dental care, and or other health and wellness programs. Benefits and cost sharing may be different than in original Medicare, but in all plans, you usually pay deductibles, copayments, and coinsurance amounts that vary by plan. You can join a Medicare Advantage plan when you first become eligible for Medicare during your initial enrollment period. Again, the initial enrollment period is that 3-month time period before you turn 65, the month you turn 65, and the 3 months after you've turned 65. You can also change your plans during the annual fall enrollment period, also known as open enrollment period. Again, that takes place October 15th through December 7th each year, with the coverage beginning January 1st of the following year. There's also an open enrollment period for Medicare Advantage plans. That takes place January 1st through March 31st each year. There are programs available to help people with limited income and resources pay for their Medicare costs. These include Medicaid, Extra Help, and Medicare Savings programs. If you think you might qualify or need help, call Mapp and we will set up a private appointment with you. Medicare fraud is the most common scheme affecting seniors. It can be services that you were billed for and you never received, equipment that you never got or was returned, someone using your Medicare or Medicaid ID card, or even a company using false information to mislead you into joining a Medicare plan. If you or someone you know has encountered Medicare fraud or Medicare abuse, let MAP know. MAP can assist beneficiaries if they feel that they are victims of fraud and abuse. MAP is here for you. If you would like to speak with a counselor about your specific situation, give us a call. We are counseling currently over the phone and through Zoom. Our service is confidential and unbiased, and no question is too trivial. We have to deal with the very complicated questions as well. You can give us a call at 800 803 7174. More information and help is available. The Medicare New Handbook is mailed to each household with Medicare yearly in the fall. It includes information on the Part C and Part D plans available in your area. There are other publications available as well on Medicare.gov. And the Medicare helpline is open 24 hours a day, including weekends. And of course, you can always call MAP 1-800-803-7174.